Good evening, everyone. I'm Governor John Carney. Thank you for joining us for this live COVID-19 update Q&A, focusing on vaccinations, which is probably the most important thing, the most important thing that we're doing in fighting COVID-19 in our state. Normally, we would have had a press conference this afternoon on the update for COVID-19, and we would talking about our testing results, look at our data dashboard, and go to our Division of Public Health. And I'm joined tonight by Dr. Karyl Rattay, our two sign language experts, Pam and Alexandra. Thanks for joining us and being with us as well. This is going to be a little bit more conversational than our normal press conference. I'd like to set the table up front by talking about our challenge that we face with allocating limited supply of vaccines that we're receiving from the federal government, working through a priority list, and Dr. Rattay will talk about how we got to that priority list, talk a little bit, a lot, and answer your questions about the next phase of vaccinations, which is to go on to what we call the second of phase 1B, if you will. 1A was the vaccination of frontline healthcare workers, police and fire paramedics, our first responders, and those critical personnel in our healthcare industries. We received back in December and early January about 50,000 doses of the vaccine, and we distributed about 30,000 to the hospitals. Our main partners, particularly with the most front-line healthcare workers. The hospitals worked hard to get their staffs and their doctors and physicians and nurses and frontline people vaccinated, and it turned out that it wasn't moving as quickly as possible. We had some vaccines that we were pushing out to other partners to get those 1A priority folks vaccinated, and law enforcement and first responders, and that wasn't going as quickly as we wanted it to go. So, 2 or 3 weeks into it, we were sitting with more vaccines in the warehouse in refrigerator freezers than were in people's arms. And we were hearing a lot from the public about why are things not going faster? And we were asking ourselves that, why can't our partners move a little bit faster? What can we do to help? Because the priority being, let's get our 1A, our priority frontline healthcare workers who's done a tremendous job through this pandemic, the last 10 months of this pandemic, doing most of the testing back in the spring, and then taking care of folks that presented with serious COVID-19 sickness. Over 1,000 people, 1,021, I think the number was today, of Delawareans have died. Sadly, the president-elect and vice president-elect are down honoring those who passed away in front of the Lincoln Memorial tonight. The biggest effort that we can make right now is to get vaccines in people's arms. And so we made a decision to try to move those vaccines that were in refrigerators on shelves into the community, onto people's arms, getting those 1A priority folks vaccinated, and be prepared to move to 1B, which are, as I said, those over 65 and essential workers in other categories than healthcare and first responders. And we'll talk a little bit about that. So we had some successful, what we call pods, or large-scale vaccination venues, mostly through Delaware motor vehicle lanes, and you've probably maybe seen pictures of them. And so we determined that we would do that in a week, almost 10-day sprint, to get as many vaccines as out there that we had out there in people's arms. And we did about 10,000. It was successful. We had about 10,000 out over the weekend in pods at the DMV in Kent County. We reached out into Sussex County, and with a pod that we did at Salesianum School yesterday, I was there most of the day. As part of those pods, we targeted the 1A frontline healthcare workers, but we weren't getting as many signed up, and we didn't want to lose the opportunity. So we reached out to certain senior groups that service those who are 65 and older, Modern Maturity Center in Dover, the Cheer Center in Georgetown, as well as the Salesianum venue was situated right across the street from a senior high-rise, 5 or 6 blocks from 2 more high-rises. We reached out to other organizations in the city to get some more demographic reach there, and signed up as many people as came. The word got out that we were doing these pods. Lots of people came out, 65 and older, and we vaccinated them in those venues. What didn't work so well, obviously, is the fact that we got a lot of people by word of mouth who came, hadn't been pre-registered, and other folks complained about, well, what about me? I didn't get that information. And I'll take responsibility for that as governor. My priority was to have these pods at the DMVs, get our frontline healthcare workers vaccinated, take back some of the vaccine from those who hadn't utilized it. We took 2,000 back from one of the hospital organizations, got them out into people's arms. And while all this was happening, the federal government said your future allocation was going to depend on how well you did in the past in getting your population vaccinated. And I didn't want to risk losing any allocation in the future because we hadn't been successful with our throughput in the short term, because we were being careful appropriately about who we were doing it with, what our partners, helping our partners get up and running. But we just really had to move those vaccines, and we did, and we are this week. And by the end of the week, we'll be better positioned as we move now into the 1B, 65 and older, the whole group there. That's about 200,000 Delawareans. And so it's going to be a challenge. You heard me say earlier, we only get 15 to 20,000 doses a week. Just do the math. We're not going to have enough to do every 65 and over tomorrow. So we've been working with Dr. Karyl Rattay. I'd like her to first describe real briefly the process that went through in establishing the priority for 1A and 1B. And it's basically when you don't have enough vaccine for everybody and you can't do it tomorrow or this week, you've got to allocate it based on priority. And that was done scientifically. And Dr. Rattay, could you explain that for us right now?
Yeah, I can. And I will say this is, I think, the most challenging aspect of a vaccine initiative like this, when clearly you don't have enough for everyone. And so there is a group called the ACIP, which is part of the federal government under the CDC, really smart people who have lots of expertise in the science around COVID now, vaccine science, as well as ethics, who spent many hours of public meetings that you can watch deliberating, who should be vaccinated first, second, third, etc. They put, tremendous amount of thought into that. And then in Delaware, we have an ethics committee, which we activated months ago to really provide input based on, those ACIP recommendations, but also based on Delaware, what we know in Delaware, and really grateful to that ethics committee. But, we didn't make these phases up. We didn't, we didn't create all of this. We shaped it to be what we thought, best fit the science. We're really focused on several things: saving lives and preventing hospitalizations. And you've probably heard the governor talk a lot about how, we worry about our hospital capacity. So saving lives, preventing hospitalizations, preserving our critical infrastructure, which again, our healthcare workers are so critical. Our EMS providers are so critical. Our long-term care providers are so critical, and also equity, making sure that we're reaching everyone. And so those are really the principles upon which these phases were determined.
So it's a process that's not determined by the governor. It's determined by groups at the federal level with this kind of expertise. And at our local level, we adjusted it. We actually moved that senior citizen category down from 75 to 65, and that's where we are today. Let's first take a look at the numbers to see where we are with respect to the spread of a virus. You see that on your screen right there. 700 new cases that's a daily average, a 7-day moving average. That's 700 new positive cases of COVID-19 with testing that runs now anywhere from 4,000 to 10,000 a day. 9% is the number of the percentage of the tests that we do that are positive. So you can see we test a lot more people who aren't positive, but when you're testing as many people as we are, you're going to come up with a lot that are positive. So, and you can see if it were 10,000, if it was 10%, it'd be 7,000 tests. So it's something less than that. Hospitalizations, you can see, is flattening out. Both new cases and hospitalizations seem to be, we're fingers crossed, we're hoping they're flattening out. We was expecting a higher rate of new cases, higher percent positives, and higher hospitalizations. We did reach a peak a couple days ago, maybe last week, over the 470 mark in hospitalizations. The hospitals are still doing a very good job. They've got better treatment than they did back in the spring. So we're moving along. So let's move to the testing and get to the rationale about moving to 1B. I mentioned it before in terms of priority. You can take a look at our weekend briefing slide. So we started to focus, really had to try to close out that 1A pod. So we decided to have these big events at DMVs there in Kent County, inviting first responders and hospital workers from both Sussex County and Kent County. We've moved, I want to say 3,000 or thereabouts a day at each location, 2 days. So moved a lot of people through there. Then we had the one pod at Salesianum School yesterday, where we moved just short of 1,000. In each of those, we opened up a little bit because we didn't get all the demand from the 1A population as we expected to those targeted senior groups. And this is, again, where the confusion came. We figured if we targeted and managed that, we wouldn't have the influx of people 65 and over that we saw. So there's some confusion there. I'll take full responsibility for that. The bottom line was we were able to get more needles in people's arm, and now we're moving to that 1B, that very big group of 1B priorities, 65 and over, and those essential workers as well. Dr. Rattay, why don't you walk through some of this? Let me just close out by thanking all those people. We had volunteers at the DMV and the pod. We had National Guards, men and women at Salesianum School. We had Bay Health workers. We had Kent County paramedics, really all pitching in. I saw our Secretary of Transportation was there, directing traffic. I saw the Executive Director of Special Olympics volunteering. So a combination, a really strong effort, about 50 persons strong, to get out 3,000 vaccinations in each of those days at the DMV. Dr. Rattay, why don't you talk about some of the groups involved in this 1B that we're opening up today and moving on to tomorrow?
Yeah, thank you, Governor. So, I mean, first, we are really, really, really excited to move into phase 1B. You know, we think this is so critically important for saving lives and preventing hospitalization in our state. But it is a big group. 1B is about 200,000 people in our state. In 1B, we have all individuals who are 65 and plus, or 65 and older, and frontline essential workers. So people who, through their work, are at highest risk of contracting COVID. So that, of course, includes fire and police. Some have already been vaccinated because they also provide health services in their job, but correctional officers are at risk, as are educators and school staff, especially those who might provide might teach kids who can't comfortably wear masks. Same with childcare providers, who are often providing support for kids without masks, and other folks, food manufacturing. I think y'all remember very clearly in the spring, the poultry worker outbreaks, people who work in close distance to one another, people who have difficulty social distancing are at a higher risk. So, you know, all of this entails, again, about 200,000 people. And although we're really excited to get to this group, the reality is, you know, the supply, certainly we don't have 200,000 doses. And so it is going to take a while to get through this phase. We're going to, as quickly as we possibly can, get vaccine out to people. But, you know, it's a lot of people in this group.
Yeah, and so one of the things we learned, obviously, which we knew was a big risk since we targeted certain groups, that we need a registration system. And so we do have a registration system that's going to go live today or tomorrow. Dr. Rattay will clarify that. We're going to have, obviously, since we don't have, we're getting right now about 15,000 to 20,000 new doses a week from the federal government. We need more, we're going to need more. And one of the reasons for doing what we're doing this week and over the weekend is to demonstrate that we can vaccinate more than what the federal government, more people than what the federal government gives. So we can increase our allocation. So Dr. Rattay can talk a little bit now about this 1B registration process. Obviously, it's got to be a lot better managed if you have a registration process. It also means that you're going to have a waiting list and a line, if you will, because we don't have enough vaccine. We don't have the capacity to get it into people's arm as quickly as people are going to sign up. So Dr. Rattay, why don't we move to talking about the registration system so we can get to our all the questions that were pre-submitted and others that folks have. Basically about is, where do I sign up? How do I get the vaccine that I need?
Yeah, absolutely. So we're also very excited to launch our waitlist system tomorrow for people to request an appointment for vaccination. Now, it's only open to those who are 65 and older at this point. In fact, if folks are under 65, they won't be able to go, into the system. So, that's the first question that is asked. So we're really through this system right now. This will change, but right now we're really focused on our seniors in Delaware. And when they go to the link at de.gov/COVID-vaccine, you'll find it and you'll see it on the next slide. You'll put some information in, and it's really simple information. I mean, it's first of all, your date of birth, but then also your name and your address, some demographic information, and any chronic diseases that put you at risk for COVID-19 consequences. So it's really quite simple. Once you submit it, it puts you on this waiting list. And then when we're ready, when we've got slots available, which we do this weekend, which we'll talk a little bit more about, we'll get an invitation out to folks. And when you receive an invitation, you need to respond probably within 24 hours, so that if people decide they don't want to take their slot, we'll be able to invite other individuals. A couple of things I want to emphasize on this. Putting your name in there multiple times isn't going to get you more likely to get an invitation. It's not like a raffle. So it's just put your name on there once, and you may not get an invitation the first time or the second time, depending, and we're using some, we assume that we're going to get a lot more requests than we have spots for, but we'll keep the names, and we'll keep, as events become available, we'll get invitations out to people. So don't worry if you don't get an invitation, first time. However, if you don't get an invitation first time, we do want to also suggest that you keep an eye on our website. See if your local pharmacist is doing vaccination, or you might already know that your healthcare provider is providing vaccination. So, there are other options, but that's really what this looks like. I mean, once you get the invitation, you want to make the appointment as soon as possible. So keep an eye on your emails. Please try to check your emails a couple times a day, just so you're on top of this. Now, we know that there are some people who don't have access to the internet. I will say the internet is the easiest way to do this by far. You are going to wait much less time. You're not likely to wait. We do have a call center that will be able to register people. But again, we really recommend going online. And if you don't have access to internet, maybe you have someone in your family or someone else who can help you get connected. So that's really what the registration process looks like.
Maybe you should talk about, this is a partnership. We normally in a given year for flu vaccination, We partner with primary care physicians, with the pharmacies primarily, and we will do that with this as well. In fact, a portion of the allocation we get from the federal government will go to those partners. And so it might be the case the best way to get a vaccine, I would think the best way is if your primary care physician is participating, he or she can give you a vaccine if you're 65 and over, starting presumably on tomorrow if they're signed up. We found that some primary cares aren't doing that. Some are relying on the pharmacies in the area in which they serve. And so there's gonna be a learning process to figure out how much can the pharmacies deliver, what's their weekly throughput capacity gonna be, what's the allocation that they should get from the state, and then filling in with these what I call high throughput, large vaccine operations at DMVs. We're also looking at a partnership with our testing partner. That's been a very good relationship with Curative. We have ramped up from testing somewhere in the 20 to 30,000 tests per month range to last month doing 200,000 tests. Remember, we've got to do 200,000 tests or between 100 and 200,000 tests a month, as well as many vaccinations as we can possibly do to get through 1B and onto 1C. Dr. Rattay, do you want to talk about the relationship with those other partners?
Yeah, I mean, those other partners are so critical now and moving forward, especially as we get more and more vaccine in the state. But, many people absolutely prefer having their primary care provider provide their vaccine. We have a number of specialists in our state as well, ENTs, allergists, orthopedic surgeons. I mean, there's a number of groups that have stepped up. And so it's very possible that you'll be hearing from them soon. We've asked all of them who are participating to focus on people who are 65 and older in our state right now. You're not going to be hearing from them if you're a member of the critical workforce that we talked about. They're going to be focusing on people 65 and older, but you may very well hear from some of these partners soon with an invitation to sign up with them. So, please take advantage of that if that happens. And these partnerships, the amount of people, whether it's providers or pharmacies, that are providing these vaccinations is growing every day, and they're getting more and more able to vaccinate more people. So as we get more vaccine in the state, we're really excited that we've got this infrastructure of partners that is really going to be able to help us help you get your vaccine in the place that is the best fit for you.
And we're going to pick up any slack and actually get more as the availability, the supply of vaccines increases with our large throughput operations. And let's take a look at the ones that we have coming up. As I said, we determined that we wanted this week, last weekend, this week, and this weekend to be to take up all those vaccines that are sitting in a freezer somewhere, not all of them, but the majority of them, and get them into people's arms. And so we've got high throughput venues on Friday at the Delaware City DMV, Saturday at and Sunday at the Delaware DMV, and then Saturday and Sunday at Georgetown. And so take a look, keep your eye on that, go down and register. It's not going to be a walk-up like some of these others were before. That's the purpose for having this registration. Anything that you want to add to that, Dr. Rattay, and so we can quickly move to the questions that we know that folks have. All right.
Nope, I'll just emphasize, because our experience this past weekend was a little different. We had, a lot of people just show up, but that's not going to be the way these look going forward. We want these to be organized. We don't want people waiting in long lines, although people were very patient this weekend for sure. We really want this to be organized. And that means too, you don't have to try to show up 3 hours early. If you have an appointment, you show up when your appointment is.
And for those who experienced some confusion there, or maybe some delay, I know there were a handful of folks at the Salesiana pod that didn't make it at the end, not because we didn't have vaccines, we actually did, but they ran out of needles for some reason. I apologize and take the responsibility for that, but I'm really happy, and I want to thank all the volunteers and those that helped us get the vaccine in people's arms over this weekend and through this week as well. So why don't we go? I think John is out there with questions that have been pre-submitted and some that no doubt have come in during this conversation.
Thank you, Governor and Dr. Rattay. Our first question, we received multiple pre-submitted questions about multiple bookings on the registration site. So we had one question: can a husband and wife sign up on the same form for the same time slot? What about a 65-year-old and their parent, or should they all register separately on the site?
Yeah, so that's a really great question. I mean, everybody should put their names in separately. Now you can put your parents' names in for them. You can, it's pretty easy information. So, you can help others get their information in. But that doesn't mean everybody will get the invitation at the same time. So, for example, age is one of the most important risk factors for adverse events. So if you're putting in your information for your parents, it's very likely they're going to get an invitation before you do. And you can still drive them to the pod, but you may not get your invitation to get vaccinated at the same time. Same with a husband and wife. It kind of depends if they're, of similar age, similar risk or not. So we know that might complicate things for some people, but that's the way that it will work.
One specific follow-up question, Dr. Rattay: can members of the same family use the same email address to register?
Yes, members of the same family can use the same email address. When you get the invitation, you just want to make sure that you know who got the invitation. And of course, you want to make sure you get the other information. So name, date of birth, accurate for each individual, but it's fine to use the same email address.
Thank you. And then we have a question, Bill from Kent County. And I think Dr. Rattay, you covered some of this in the presentation, but he asked, what information do I need tomorrow in order to register? So just basic information that people need to register on the site tomorrow.
Yeah, it's not like you have to have, medical records or, your insurance card or anything like that. Most people have all this information in their head. It's your name, it's your birth date, it's your address and what chronic conditions you have. We have a list of conditions that put people at higher risk of consequences for COVID-19. So again, it's really pretty simple. You really don't need anything. Just bring your, get yourself onto the site and put the information in and then just push submit.
Thank you. And so from Christy Adams in the pre-submitted questions, we had several questions about workforce vaccinations. Christy asks, as a Delaware state employee who has been told by their HR department that they are 1B eligible, what is the process for getting the vaccine? Do they need to make an appointment on the website, get a voucher from their employer, or is there another process?
So right now, this pre-registration or waitlist system is only for individuals 65 and older. Now, if you do work for the state and you're 65 and older, you're welcome to use that system. But for workforce, whether it's state employees, teachers, poultry workers, et cetera, each entity, each employer is working on their own plan, and they're going to look very different. So in some places, like poultry workers, where there's employee health there and there's people who can vaccinate, that's going to look very different than for most state employees, where they may have somebody come on site, but they may get a voucher to go to a pharmacy. So you really want to look to your employer. So if you're at work for the state, it would be your agency is going to give you information when and where you get vaccinated. So you just want to hold tight. Again, I do want to emphasize that not every employee group is going to get rolled out at the same time. There's just no way to do that. So we're going to be slowly rolling through these work groups. So even if you are in 1B, that doesn't mean that vaccine is going to be available to you in the next week. It may be, multiple weeks before it is available to you.
One of the largest public employee, state employee groups that we have are teachers and educators. And there is a separate arrangement that we're working on through the pharmacies to do events for our teachers, given the essential work that they do. And our other main objective is getting more children back in school for in-person instruction. So pay attention if you're a teacher and educator out there. Pay attention to your school nurse and administration about the opportunities to get vaccinated through that program as well, working with DOE, Department of Education.
Thank you, Governor. We had a question from Jim in the live stream comments about volunteers. And Jim says, I am trying to volunteer for vaccine distribution. I know I'm not a healthcare worker, but I know how to give a shot. Governor, can you just talk about what you saw at the DMV this past weekend in terms of volunteers working? And Dr. Rattay, can you say anything about the Medical Reserve Corps and what kind of help we need?
Yeah, I'm not the best one to talk about how to get signed up, but I saw volunteers doing incredibly important work, even if it was just working with people. You know, after you get the vaccine, you've got to wait 15 minutes to make sure there's no adverse reaction. And at the DMVs, people stay in their cars and they wait in the parking lot. So we had some volunteers going around there. You had people in the lanes doing traffic direction, all kinds of different things, taking people's information. I was a volunteer for a while. I'd spent most of my time helping those who were mobility challenged upstairs. One of the things we learned is if you're going to do 65 and older, you better have a site that's very easily accessed by folks that have walkers and other assistance. There are people that just provide basic information. And so, Dr. Rattay, I don't know whether you can provide some information about how volunteers can sign up. It's a really rewarding experience. The people are delighted to have the fact that their numbers come up and they're getting this life-saving vaccine. And you just see just really wonderful people. It was a really positive experience for me, notwithstanding the fact that we had more people than we could handle towards the end of the day. But so many people were able to get that shot during the course of the day.
Yeah, I mean, we can't run these without our volunteers right now. It takes about 150 people, to work these events each day. And our Medical Reserve Corps, so Delaware Medical Reserve Corps, I don't remember the URL, but if you just Google Delaware Medical Reserve Corps, and it's UD is organizes this, but this is how it's a partnership between us and UD. This is how we organize volunteers. We've worked together for many, many years. And I know a lot of people think that it's really vaccinators that we're looking for. And I have to tell you, I vaccinated this weekend, and as the governor said, it really is just so uplifting to get to volunteer and do this work. But we need people who can help register people. We need people who can screen people. So, we need anybody who's willing to, people scribe, they have to write down, the lot number for vaccine, et cetera. So, we'll take any volunteers. It doesn't just have to be vaccinators. So go to the UD Medical Reserve Corps and sign up.
And this is really, really important, because one of the questions that we have, we ran 10,000 people through over the weekend. By the end of the week, maybe 20,000 total. The question is, can you keep that up? Can you do that on a regular basis as you get that allocation from the federal government? We have to prove that we can. I believe that we can, but we can't do it. We can't rely on the same people all the time, because we're just going to burn them out. They've already been working to the bone over the last 10 months since the first case back in early March. And so doing all the testing and now contact tracing and now the vaccination. And so we're going to need more troops. We're going to need more help to sustain these high throughput operations that we do at the DMVs, which are really effective. We've had really good success with the fire companies as well. Open the bays, let the cars come through. I think that's a really attractive alternative, particularly in the lower part of our state. And so we just need to make sure we're getting a good distribution across, making sure everybody has an opportunity to get vaccinated at these large-scale operations, and that we can keep up and go beyond, frankly, the allocation we're getting from the federal. So we're begging for more vaccine and demonstrating that we can get it out there and get it into people's arm. The faster we do that, the better the sooner we're going to get back to a more normal lifestyle here in our state.
Thank you. And we received 3 similar questions, the Governor. One from David Skillman from Wilmington. He says, hello, it looks like the only sites scheduled for mass vaccinations are Delaware City and Georgetown. Speaking of the sites planned this weekend, are there any plans for an event or additional events in northern Delaware?
Yeah, we're working on that. I guess that's the best I can say now. And I get that. One of the reasons, frankly, we had the big event in central Delaware that was really targeted to Kent County and Sussex County, and kind of I forced the question to at the very last minute. We got the National Guard, man. We call on those men and women, they're there. And we had volunteers. We had Department of Public Health, Division of Public Health out there at Sleazy Adams School. We got almost 1,000 people through that. That was very much a last minute thing. But going forward, we have to have regular of these events. Hopefully our partners, our primary care and the pharmacies will pick up a big part of that load. I'm here and now, we're trying to get answers from our hospitals about how much they can do outside of their own staff. And there's a willingness there to do that and calibrate the need for those other larger scale operations based on the ability of those partners to do vaccinations at the local level. I hear your concern. I can tell you we're focused on it. And particularly focused, here's going to be the hardest problem. And that is the seniors. My mother's 89 years old, but she's very mobile. She's not the biggest challenge. Her neighbor is not very mobile. And I don't know how she's as old as my mother is, but she's up there in age, very old. Those are the kind of people. We have Meals on Wheels for the same reason that people can't get out to get this senior center. So we're going to have to come up with a good kind of outreach where I don't know whether we're taking the vaccine to them or what it is, but it's going to be a tricky question. Those people that showed up over the weekend, they're very mobile, very connected. Those aren't as big a problem. And there might be older folks too, younger, maybe they're 65, 66, maybe they're 80 or so, but they're healthy and they're mobile. It's those that are, and we had a lot of people that weren't so mobile that came through as well on at Sleazy Adams School. So those are the kinds of things that really came into sharp focus as we tried out these operations over the weekend.
Thank you, Governor. We have a lot of questions in the comments, Dr. Rattay, about educators, but also about school staff, bus drivers, et cetera. Can you say whether they are included in the education vaccination plan and any additional information that you can share?
Yeah, absolutely. And that's a really great question. So all school staff are considered 1B. Now, I know Department of Education has been working very closely with our team in identifying who's at the highest risk, because some people are at higher risk than others, whether it's based on age or what's the nature of their job. You know, special education teachers often are working with students who aren't able to wear masks or aren't able to keep masks on, so they might be at higher risk. So, Department of Education is really done a fantastic job of thinking through, you know, all the different staff and thinking custodians and bus drivers and, you know, everyone on the team fits under 1B. But again, not everybody's going to be able to be vaccinated at the same time. So they're looking how best to roll it out, again, based on risk.
And by the way, Dr. Rattay, large percentage of our school nurses have already been vaccinated because they're the frontline healthcare worker. They were part of one of the early large-scale operations we had at the Kent County DMV. Isn't that correct?
Yeah, I mean, it's one of our, I think, really extremely exciting success stories. At least 90% now of our school nurses in the state of Delaware have gotten their first vaccine, which is pretty awesome.
Thank you, Dr. Rattay. Here's another popular question in the comments. This one from Maureen on Facebook, who asks, how do you get the second shot 28 days later? I'll just add on to that. Do you need it exactly 28 days later, but how will you find out how to get the shot?
Let me see if I can frame this question a little bit more broadly as well. And that is, initially, folks, including the state, was holding back second doses. Turns out the federal government was holding back those doses as well. And then it became apparent that there was a bigger priority to get first doses out, and the federal government stopped holding back second doses and encouraged states to do that as well. We are, I think, holding a small amount of second doses, as are maybe some of our providers, but there's a greater priority in moving and getting more and more people with that first dose. That's not to say we've lost track of that. It's just to say, as we move on, that supply has to increase, because we're going to have greater capacity to move people through getting their first dose. And then we're going to have people coming on 20 some days later looking for the second dose, and that's going to take up some of that capacity. So it's a logistical problem, and it's a supply problem. And so it's something that we're going to have to work through, and we've already been thinking about. Great question.
Yeah, it really is a great question. And it's, it's something vaccinating folks this weekend that we got asked a lot. So, depending on whether you get the Pfizer vaccine or the Moderna vaccine, one is your second vaccine is 21 days after the first one, or after, or 28 days or after. And so that in and of itself already makes it a little confusing, right? But for folks who got vaccinated this weekend, as an example, they got a card. Everyone will get a card that will tell you your date and what type of vaccine you got and when you need it again. But one of the best things now about this new system and the registration systems is that you have to have an email address to register. And we just weren't getting email addresses on a lot of the forms that were coming in. When we get your email address, you're going to get reminders. So that helps, of course, as well, so that you remember, oh yeah, that I gotta get scheduled for my next round. So for people who are now starting to get their first vaccine, by the time they get around to their second vaccine, there will be more options. So you can come to one of our mass vaccination events, but also, again, pharmacies, providers, and other places. So just because you went to the DMV, as long as you know you got Moderna, and you can get Moderna with your healthcare provider or pharmacy, wherever, you can get your second dose. But make sure we get your email addresses wherever you get your first vaccine, so we can get you reminders, and keep an eye on our website to make that appointment or work with your other providers or pharmacists.
Thank you, Dr. Rattay. I know this is a difficult question that we've heard a number of times. Robert, in the pre-submitted question, says, I am 59 with severe underlying health conditions. When can I get vaccinated?
Yeah, this is, I think, a heartbreaking question, because we know that there's a lot of folks who don't meet, the age limit is 65, but are also very concerned about their risk for COVID. Again, as we talked about, the determination of the phases and how it gets rolled out was really based on science and who's at highest risk and really preventing the most adverse consequences. But we do know that there are many folks who don't meet the phase 1B requirements, yet are very concerned. Most people with chronic underlying conditions, or many, especially if they put you at risk for COVID consequences, are in the 1C category. So we just ask folks in the 1C category to be patient, hang tight in the meantime, which we know you're all so tired of staying at home and wearing your face coverings and distancing from others. We ask you to continue to practice being safe. And as soon as we're able to get into 1C, we'll be rolling it out in a different way. In fact, we expect within a few weeks that you'll be able to register to get yourself on the wait list, so that when we get closer to 1C, we'll be able to extend those invitations as we're rolling it out.
Thank you. And a lot of questions too, again, about the process at these larger vaccination events. Natalie Birch asks, please describe the logistics process once you arrive at a vaccination event. What items must be brought to the event? Should people bring insurance cards? Is there anything else they should know?
Well, I could describe the what I saw, which was at a walk-up event. So people came to the Salesianum School. The vaccines and the thing was in the gymnasium. Unfortunately, there were steps to get in and up to the gymnasium. The kind of handicap access was around in the back. That created some problems. I stood and volunteered at the top of the steps, helped people up the steps, gave them a registration form. They filled out the top. They left the second part for somebody on the inside. They answered questions on the back of it in terms of screening questions. If you had allergic reaction to this or that, I didn't really read what those questions were. You signed the front. You were able to do that at a table inside the door. Everything was social distance. You had your mask on. I had my mask on. And then they moved you through. You got in line for your shot. They gave you the shot. You gave them the paper. And then you were waiting for 15 minutes to make sure you didn't have an adverse reaction. And then off you went out in your car. I got so many people who said, oh my God, that was so easy and so well organized. DMV is a little bit about the same, except you stayed in your car, I think. Dr. Rattay, is anything you want to add that I missed, particularly for the DMV? It just seemed like it went very easily for folks.
Yeah, I mean, it really is a pretty easy process. You just follow, there's people out there directing traffic. They tell you where to go. Now, I do want to make sure people know that we're going to be checking driver's licenses and as well as, looking for your registration. So again, these events going forward are all for people who have registered and have, had received an invitation.
And are 65 and older.
And are 65 and older for now. Just a couple things, as you go through the steps and you're kind of waiting in line, you get the paperwork. We ask people to read it and to download this app that allows you to interact with folks. It also gives you reminders about your next shot. And also we ask people to make sure that you are dressed in a way where you can easily expose your arm. We saw lots of people who had to kind of get out of their vehicles and undress so that they could, expose their arm. So when I think about that ahead of time, but overall, it really is a very, very simple, easy process.
One other thing that I'd like to add is with the partners that we're bringing on, depending on who that partner is, you may have to present your insurance card because they'll charge you. There won't be a copay, no copays, but they'll want to get and charge your insurance, and that of course limits the cost for us as well, the money that we would otherwise have to pay them.
Thank you. So Pam in the pre-submitted questions also says, my husband and I moved permanently to our second home in Delaware last May. Can they get their vaccines in Delaware? Where should they register to get their vaccines?
Yeah, great question. So for people who have two homes, one of them being in Delaware, if your number comes up when you're in Delaware, then you should get your vaccine in Delaware. So depending on where you are, when it's time for your phase, that's where you should get your vaccine. And that's really the way all states are looking at it. I mean, we're really asking people who don't live in our state, unless you work here and your employer is offering it to you, to not come to Delaware. And I there will be kind of it will be hard to come to many places to get vaccinated in Delaware if you don't live here or work here. But for those who have two homes and one of them being Delaware, it's certainly fine to get your vaccine here.
Thank you, Dr. Rattay. We're going to take two more questions and then I'll turn it over to the governor for closing remarks. Margaret asks, after I register and wait for notification to sign up for a location, do I have a certain amount of time to respond to that invitation? So can you just go through that process quickly one more time for people who just joined us?
Yeah, absolutely. So yeah, you go to the site and you put in your information. Again, pretty simple. You push submit, and then when we're ready to send out the invitations, we push them out depending on how many slots that we have available, and then there will be potentially a limited amount of time, probably 24 hours, depending on the situation, for people to accept their invitation and make their appointment. And the reason is, especially as we get closer to the event, let's say somebody got themselves on the wait list, but then they got their vaccine at the pharmacy and they don't need to use it. We want to give that slot away to somebody else. So try to keep an eye on your email after you've gotten yourself on the wait list, so that when you get the invitation, if you want that invitation, that you respond as soon as you can.
Thank you, Dr. Rattay. And here's our last question. Andy in the comments asks, I turned 65 in February. Must I wait until my birthday to actually register for a vaccination?
I turned 65 in May, and I'm not going to get vaccinated unless there's another reason for me to get vaccinated, maybe to encourage people who are hesitant to get the vaccinated to show by example. But I would assume that that's the answer, Dr. Rattay. You can, because you're going to have to prove by some identification that you're 65 or older.
Yeah, that's right. So you gotta wait just a little while till your birthday. Happy birthday, by the way. But wait till your birthday so that you can get yourself on the wait list as a 1B participant.
And that was our last question, Governor.
Yeah, so this is an exciting day in so many ways. This morning we didn't have our weekly press conference because we had my swearing in, the Lieutenant Governor's swearing in. It was done remotely by video that had been prepared in advance, with the actual swearing in done in person. It was an inauguration for governor like no other, I'm sure, in the history of our state. This has been a time like no other in the history of a state, with a pandemic, a COVID-19 pandemic that none of us have ever seen before in our lifetime. The last flu pandemic was back in 1918. I've seen incredible things in our state over the last 10 months. Our hospital workers just doing incredible work, treating the sick and those with severe COVID-19. Our Division of Public Health, Director of Public Health, Dr. Rattay, and her team, the doctors Rick Pescatore, Rick Hong, that have been leading the effort for testing, AJ Shaw and his team at DEMA, testing now over 200,000 Delawareans a month, when we thought that 80,000 a month was a stretch goal. We're trying, teachers really stepping up, and those who work with our children in preschool operations, really stepping up and staying open, even back in March and April, and with the child care facilities. And now we're faced with one of our biggest challenges, which is to test, to push the virus down. We started talking about the spread of COVID-19 right here in our state, about 700 cases so on average each day. We're up around 450 hospitalizations, a little bit lower. We're kind of flattening out there. My hope and prayer is that we start going down, and on the other side of this peak, we have fewer positive cases each day. And each day we get hundreds, if not thousands, of Delawareans with the vaccine that'll protect them from serious illness, protect them from fatal illness from COVID-19, and lead the way to getting us back to an ordinary way of life that is so meaningful to all of us. We've seen the pain. I've seen it directly. We all have in our own families and our neighbors and our friends. People have passed away from COVID-19. People have been isolated. People have not been able to see their loved ones because of the stay-at-home orders and quarantine responsibilities. We're ready for this. We're ready for this vaccine. And I can assure you, as your governor just sworn in for the next 4 years this morning, this is going to be my top priority, to make sure that we get on the other side of this. We got every Delawarean that wants to get vaccinated. And I'm going to try to get the people so far who've been hesitant to get over that reservation and get a needle in their arm. If you think about the numbers, we have to vaccinate 750,000 adult Delawareans twice. That's 1.5 million doses. If 50% of the people don't want that dose, it makes our challenge half as hard, right? We want everybody to do that. So we're focusing our efforts, what it takes with large operations, with our foundation, primary care, pharmacies, healthcare organizations, to get as many people through as we can so that we can hit that million doses mark. That's our goal. We're going to keep at it. We got a great team on the field, and we need your help. The most important thing that you can do with all of us, wear a mask, keep socially distanced, and get vaccinated. Thank you again for the opportunity to serve as your governor for 4 more years, to fight this thing to the end, to get out on the other side, get our economy going again, and live life like we like to here in our state. One last word. This was a special day for the state of Delaware as we sent off one of our own, Joe Biden, to be the next president of the United States. It's an incredibly historic thing for our state, for all the friends and constituents that Joe has worked for over his 40-plus year career. It was a privilege for me to share some remarks, to send him on his way. We wish him the well. God bless him and our country and all of you. Thank you very much for joining us tonight.